Hello, I'm Kevin Renner, and I'm with CBHA. I'm one of the members of the COVID-19 task force here.
My name is Dr. Choi. I'm the Chief Dental Officer here at Columbia Basin Health Association.
So, Dr. Choi, there's news that there is a significant change in the operation of the dental clinic at CBHA. Can you explain to the community what that's about, who it affects?
Yep, definitely. At CBHA, we've been trying to keep the access open to all patients as long as we could. And I thought we were doing a very, very good job making sure that all the providers and patients are taken care of and well protected from the current coronavirus pandemic. Just this week, American Dental Association and the Department of Health echoed the guidelines that we should only be doing emergency patient access at this time and delaying all preventative as well as non-urgent services to a later date. So we are abiding by that guideline that has been set forth by the American Dental Association as well as the Washington State Department of Health.
And so if I'm a patient, how do I know if I have a condition that's emergent and that I could actually come in and be seen?
That's a great question. If you're a patient of record or if you're non-patient of record of CBHA, and if you're having any symptoms of a pain, swelling, a trauma that might have occurred, and you find that, gosh, this is it's sensitive or it's painful, absolutely give us a call and we will go ahead and triage you over the phone. And you'll be actually connected with a dentist that will be triaging over the phone as well. And if we find that, yes, this is definitely a case where there are sensitivity and this is emergent, we will go ahead and have you come in and you will see a dentist face-to-face, and they will go ahead and take appropriate measures to see what needs to be done. And when we find that there are certain procedures that needs to be done or needs to be performed, you will once again see another dentist. Depending on the condition that you're in, you will see a dentist and they will go ahead and do the procedure for you. Once again, emergency procedures that as needed.
And why did the State Department of Health and the American Dental Association make this recommendation in the first place? How can this really have an impact on anything that could be of benefit either to the medical clinic or to patients or providers? What's the rationale behind taking this step?
The reason behind that I see is that this current virus is transmitted through from patient contact as well as the droplets in the air. Dental is, we are in the proximity where we're practically inside the patient's mouth, and the proximity to the patient is very, very close. Multiple, if not a lot of our procedures does create the aerosol, and that aerosol will be transmitted and transferred from patient to patient as well as operatory to operatory. So definitely what we do in dentistry as well as the staff in dental are at the highest risk of exposure, as well as the patients that are in the rooms, as well as patients or family members that might be with them are at a higher risk than other procedures and other departments in the healthcare. So I agree that this is definitely a good preventative measure in reducing the amount of aerosol, reducing the risk of exposure to this COVID virus for our patients as well as our providers.
And this applies to all three of the locations of CBHA, correct?
That is correct. At this time, for at least at this point, we have closed the other two clinics so that we are triaging and treating all patients right here at the Othello Dental Clinic at this time. But all our providers are rotating in seeing patients, both triaging over the phone, doing examinations in the clinic, as well as doing the treatments, are all being done here. One, to conserve the resources and focus the resources in one place, and two, to make sure that our patients know exactly where to go, what needs to be done, and what can be done. We have the facilities available to create an isolation to do these procedures for patients, as well as triage in our clinic as well.
So is there any timetable for return to the normal operations of the dental clinic? Do you have any visibility to that yet?
Yeah, I mean, we're very hopeful that this pandemic will, pass by as soon as whenever it ends. And I think this is the optimistic side of us. There are a lot of different informations out there at this time that says, American Dental Association has put this 3-week limit on seeing only emergency patients. But CDC and other organizations have said 6 weeks, as long as 8 weeks, and some we're seeing that it's going actually past that to several months. So we do not know exactly what the timeline for this virus staying around is, but we are prepared to make sure that we are here for our patients as well as for our community, making sure that if there is any needs for emergency, we are here for them. At the same time, we are very focused in making sure our staff, our providers, as well as the patients entering our facilities are protected as to the best of our ability.
And then what will be the operating hours of the dental clinic in Othello?
Currently, we have not changed or reduced our operating hours at this time. We are still open from 7 a.m. to 6 p.m. here at Othello Dental.
Okay. Thank you. Do you have any final thoughts or any closing remarks that might be helpful for anybody to know?
Yeah, I just echo what the public health system has been telling all our patients as well as the community, that stay home as much as you can, washing your hands often. I think it's very, very important. Keeping your distance from others. Just prevention at this time really is the best thing we can do. But at the same time, if you have toothaches, if you are ailment, if you have fallen, or if you have any trauma that has occurred where you have some oral pain, please do give us a call.
Great. Thank you. And we'll bring updates as soon as anything changes, and look forward to keeping you posted on the developments here.